present day, aside from male and female, other gender identities have been given significant recognition in the community. They are known to be part of the LGBTQ plus community. LGBTQ plus are acronyms for lesbian, gay, bisexual, transgender, and queer.
I identify as lesbian,
I identify as gay.
pansexual or bisexual.
I identify as a trans man.
I identify
The
as
plus
queer.
denotes that no
Asexual.
single acronym can adequately express everyone's gender identity or language, as well as their sexual orientation. The term queer has been used as a slur or insult towards members of the LGBT community in the past. In recent years, the LGBTQ plus movement has reclaimed it as an umbrella word for someone who is not heterosexual or cisgender. Nowadays, LGBTQ plus rights have also been prioritized.
In the Senate, there is a bill that the legislators are reviewing concerning the privileges of that community. This is known to be the SOGI bill, wherein its purpose is to affirm LGBTQ plus individuals as equals and guarantees that their rights are secured in the same way as everyone else are. They also get to celebrate their community during the month of June. This event is called the Pride March. However, given that the Philippines is a predominantly Catholic country, many issues scrutinize LGBTQ plus community. One of these is people that are homophobic, or people who have prejudice with gay people. Homophobia can take many forms, including derogatory views and opinion towards bisexual, lesbian, and homosexual people, as well as opposition to or discrimination against them. It's frequently built on misplaced fear and misinformation. Homophobia may be rooted in traditional religious values in some individuals. Parents and families may have instilled homophobic views in their children.
For centuries, homosexuality, especially same-sex relationship between men, was regarded as deviant, immoral, and even criminal. Psychiatrists and physicians started to treat homosexuality in the late 1800s. They coined the word same-sex attraction and began searching for ways to treat it. In 1952, the Diagnostic and Statistical Manual of Mental Disorder, or DSM, of the American Psychiatric Association included homosexuality among the sociopathic personality disturbances. In fact, a specific therapy was raised to address homosexuality. This therapy is known to be the reparative therapy. Reparative therapy is any effort to influence a person's sexual orientation, gender identity, or gender expressions in any way. Subjects or participants in reparative therapy are enlisted by their parents, school, and sometimes the pressure from the society. Emotional factors are fundamental cause why the subjects were signing up in the said therapy.
BYU security would catch people like in compromising positions or whatever, and they had the choice of either being kicked out of school and their families called and informed about what they had done, or they could undergo this therapy. And so we had quite a few people who were going through it. And then there were other people who felt like so much guilt over their sexuality, or had been promised that if they underwent this therapy, that they'd be able to marry and have children, and they would just be turned away. Of course, they had to have the desire to change. Therefore, if the therapy failed, then it was always their fault because they didn't have enough desire to change.
Treatment.
From my mother. My mother never accepted me because she was from a different generation, and to think I'd let her down and I'd lied these lies. I did it for her. I did it because society told me I was a criminal and I was dirty and I was filthy and I was grubby and I wasn't normal.
In this therapy, electroconvulsive therapy was used on some gay individuals, while others were exposed to even more invasive procedures, such as lobotomies. Shocks delivered by electrodes inserted directly into the brain were among the other treatments. This method of brain stimulation, together with hired prostitutes and heterosexual pornography, was used by Robert Galbraith Heath, a psychiatrist in New Orleans who invented the procedure to change the sexual preference of gay men. In addition to that, participants received chemicals under medical supervision that had them vomit when they look at pictures. Others were subjected to electric shocks, often to their genitals, when viewing gay pornography or dressing in a cross-stitched manner.
Gay men and women were involuntarily committed to psychiatric facilities by their families in hopes of getting the gay out.
They used drugs, they put people into comas to alter their minds. They used electroconvulsive shock treatment to rewire the brain or short-circuit the brain.
Basically, this involved showing the gay man pictures of nude males and shocking him with a strong electric current.
Lobotomy was another brutal procedure intended for all sorts of mental disorders. This tool was used by Dr. Walter Freeman.
Freeman's technique was you go in behind the eye through the eye socket and you just wiggle it to disconnect the frontal lobe from the rest of the brain.
Typically, this removed any personal drive, but often left patients severely disabled. Of the thousands of lobotomies Freeman performed, roughly 40% were on homosexuals. These extreme methods were part of a larger effort to suppress LGBTQ people.
Over, and we would show a man and a woman having sex, and we would play very soothing music in the background to try and get the mind to relate to that. When we got into the higher voltage with the people who had been doing it longer, you could see burn marks on the skin, and quite often they would also throw up during the therapy.
The majority of the participants were troubled by their attraction to their own sex, and those in whom they confided felt they needed help, while some participants preferred therapy over incarceration or were persuaded by medical manipulation. The majority were reacting to complex personal and social factors that prevented them from expressing their sexuality. Although many of the participants found happiness in same-sex relationships as a result of their therapy, the majority of them were left emotionally disturbed to some extent.
The impact of that was just anxiety, like extreme, severe anxiety.
I never went to like suicide ideation. Definitely have friends who have, still do. I've been to a hospital before for a friend who had, attempted to, swallow a bunch of pills. So it's definitely like a very, very real thing.
Is that something you went through conversion therapy?
Yeah. From separating like what I wanted and what was true for me with giving other people what they wanted and what was true for them, for sure. Tons of anxiety.
One of the most common critics of aversion therapy is that there isn't enough clinical proof to back it up.
The report concluded that there aren't enough proper scientific studies to conclude whether conversion therapy is safe or harmful. However, the research showed efforts to change sexual orientation are unlikely to be successful and involve some risk of harm, contrary to the claims of Sochi practitioners and advocates. And the anecdotal evidence seems to reflect that risk of harm.
The ethical implications of using punishment in therapy are also a major source of concern. Aversion therapy has been shown to intensify anxiety, which interferes with the recovery process in certain situations, according to practitioners. Some patients have also shown frustration and aggression during therapy in the past. During the process of aversion therapy, severe injuries and even deaths have occurred in some cases. When homosexuality was once thought to be a mental disorder, gay people were exposed to various types of aversion therapy in an attempt to change their sexual orientation and behaviors. Aversion therapy has been related to depression, anxiety, and suicide in some cases.
Nobody in the world knew I was there. I thought I'm never going to get out alive. That's all I was worried about. I wasn't worried about being cured. I just wanted to get out alive.
According to the Republic of the Philippines 1987 Constitution, Section 11 of Article 2 state that the state values the dignity of every human being and guarantees complete respect for human rights. Section 12 of Article 3 of the Constitution forbids the use of torture, force, brutality, danger, intimidation, or any other means that vitiates the free will of victims of torture or similar activities, as well as their relatives, in accordance with the stated policy. Although subjects have given their consent, somehow it can be considered as not consensual, since they have only just consented due to the pressure in the society. This clearly violates laws regarding human rights. To date, reparative therapy, also known as conversion therapy in the present day, is still existing. However, in the brighter side, laws have been implemented to protect the members of the LGBTQ+ in this brutal therapy. Countries such as California, Colorado, Delaware, Hawaii, Illinois, Maine, Maryland, Massachusetts, Nevada, New Hampshire, New Jersey, New Mexico, New York, Oregon, Rhode Island, Utah, Virginia, Vermont, Washington, the District of Columbia, and Puerto Rico all have legislation or regulation shielding children from this dangerous activity. Under Republican governors, 8 of these state laws or regulations were passed. The number of cities and countries, including at least 70 in Arizona, Colorado, Florida, Georgia, Iowa, Kentucky, Michigan, Minnesota, Missouri, New York, Ohio, Pennsylvania, Washington, and Wisconsin have adopted similar protections.
Kung lalawa kami pag-iisip mo, mas matatanggap mo sila.
Until now, homosexuals still struggle to fight against discrimination. For them, it is an unending battle that they bravely face in their everyday lives. Fighting against the prejudice of other people will never be easy. And until people will continue to disrespect and shame the members of LGBTQ+, this fight will never end.